Assalamu alaikum warahmatullahi wabarakatuh. This study is titled as a 10-year follow-up, a study of 119 teeth treated with apical surgery and root end filling with MTA by Fonarx etal. It was published in 2019 in the Journal of Endodontics. So, apical surgery is an important treatment option when conventional root canal treatment fails or when retreatment is not feasible. The success of this procedure mainly depends on achieving proper seal at the root end. MTA is widely used because it has high sealing ability, excellent biocompatibility, and it can promote cementum formation. However, most of available studies only report short-term outcomes, usually around 1 year, and there is limited evidence about the long-term success of this treatment. Now, moving to the aim of this study. The primary aim was to evaluate the long-term outcome of apical surgery using MTA as a root end filling material over a period of 1, 5, and 10 years. The secondary aim was to assess whether different factors could influence the outcome, including age, sex, tooth type, and the type of MTA used, and whether the surgery was performed for the first time or as a repeated procedure. Regarding the materials and methods, this study was designed as a prospective clinical follow-up study where patients were monitored over a long period of time. Initially, 195 teeth were included, and after 10 years, 119 teeth were available for final evaluation. The inclusion criteria included relative healthy patients classified as SAA1 or 2, teeth that required apical surgery, and cases with complete clinical and radiographic records, as well as patients who were able to attend follow-up visits. On the other hand, cases with prodental probing depth greater than 5 mm, apicomarginal defects, root perforations, or severe prodental disease were excluded from this study. For the surgical protocol, all procedures were performed using standardized microsurgical approach. Osteotomy was performed using round bears, and root end resection was done at 3 mm from the apex. This was followed by endoscopic inspection and ultrasonic retropreparation to a depth of 3 mm. Finally, the root end cavity was filled with MTA and the flap was sutured. It is important to note that gray MTA was used before 2003, while white MTA was used after 2003. Healing in this study was assessed both clinically and radiographically using Red and Molfen criteria. 3 collaborated observers evaluated the radiographs. Cases were classified as healed when there were no clinical signs or symptoms, along with complete or even incomplete radiographic healing. On the other hand, cases were considered not healed if there were any symptoms or if the radiographic findings were uncertain or unsatisfactory. Now moving to the results. The overall healing rate after 10 years was 81.5%. However, this success rate decreased over time, as it was 91.6% at 1 year and 91.4% at 5 years. Maxillary molars showed the highest success rate at 95%, while maxillary premolars had the lowest success rate at 66%. Mandibular molars also showed a lower success rate around 70%. Factors such as age, sex, type of MTA, and whether the surgery was primary or repeated did not show any significant effect on the outcome. So this study has some important limitations that should be considered. First, there was a relative high dropout rate of around 39%. Second, CBCT was not used, which might have provided more accurate 3D evaluation. Finally, there was a lack of information regarding previous retreatment, which could be an important factor influencing the outcome. In conclusion, this 10-year follow-up study of teeth treated with apical surgery and MTA as root end filling material showed acceptable rate of healed cases. And thank you.